Hmm. Hello, dear students. Today we are going to discuss about uh, laboratory medicine. So, general information on medical laboratory. So, coming to general information, medical laboratory. What is medical laboratory? First of all, we'll go through the definition. Okay. So, medical laboratory science (MLS) is the health profession that provides diagnostic services needed to detect and treat disease. So here, whatever diagnostic services which are required to detect and treat disease. Detection is nothing but diagnosis, and after that, doctor will start treating the disease. So it happens in medical laboratory. So coming to diagnostic services include critical. It is a chemical, means biochemical, hematological, immunologic, microscopic, and bacteriological analysis on blood, tissues, and body fluids that aid in a patient's overall diagnosis. So, coming to medical laboratory section or department, here there are different types of samples we process. One is biochemical analysis of samples, hematological. In hematology, we see here CBC. Uh, Under CBC, we'll come to know the counts of different cells. For example, what is the count of WBC, what is the count of RBC, and what is the count of platelets. All those counts will be analyzed under hematology. So again immunologic, immunologic. So immune related immune related things are analyzed here, like IgG, IgM, IgA, all those things are assessed under immunological section. So coming to microscopic it itself, where in hematology also it is useful, as well as clinical pathology also, and coming to histopathology also, microscopic examination routinely done. And even coming to microbiology also, we need to see their bacteria by using gram stain, yeah, AFB stain, yeah, other stains, etc. So microscopic examination will be there in laboratory. So coming to bacteriological. So bacteriological, again, it comes under microbiology. So where bacterial growth can be noticed, and those bacterial growth, we can stain them, and we can just have a look under microscope to identify the different types of bacteria on blood, tissues, and bodily fluids that aid in a patient's overall diagnosis. So coming to clinicians, depend on accurate laboratory data to diagnose diseases, while other medical professionals, example nurses and pharmacists, rely on this information to plan or implement treatment and care for their patient. So, in medical laboratory, one is sample collection area, we call this phlebotomy, and after that, one more department, accession area will be there. The section, accession area, yeah, accession section we call it as. And after that, once the samples are received, those samples are distributed in biochemistry and to microbiology department as well as pathology departments. So coming to biochemistry, under biochemistry, two things we had noted down. One is basic biochemistry and second one is high-end chemistry. So basic biochemistry, under basic biochemistry, we process basic investigations like RBS, FBS, PPBS, LFT, uh, RFT, and lipid profile. All those parameters will be assessed. Under high-end chemistry, again, there we can see here uh, depth like hormone assays, Yeah, further few more investigations coming to which are related to the viral load and all those things can be tested under high-end chemistry. So coming to microbiology. Under microbiology, so again there are few sections. One is serology section. We process here rabbits as well as ELISA, yeah, CLIA methods, whatever the methods, but we process here samples to look for whether serology is seropositive or negative, like retroviral test, yeah, hepatitis B virus, yeah, hepatitis C virus, and all those viruses can be tested under serology. So coming to bacteriology, already discussed here. So why bacteriology? Bacteriology, we use different specimens here to see whether the specimen is contaminated, infected by particular bacteria. So those infected samples are cultured, and we'll come to know that whether the sample is having a bacteria or not. So once there is a growth, we will see the growth, and afterwards we will have a antibiotic testing, and we'll tell that this particular specimen is having infection by particular organism, and we need further follow-up and treatment. So coming to mycology, so under mycology, so here we test for fungi, and coming to virology, here we test regarding viruses, and parasitology, we test for parasites, and coming to pathology, here pathology again it is divided into subsections. One is hematology, histopathology, cytopathology, and clinical pathology. So, what is the role of medical laboratory technologist in medical laboratory? One is laboratory work is done by medical laboratory technologist. Medical laboratory technologists perform a variety of lab tests, lab examinations, ensure the quality of specimens and test results, interpret and explain the significance of laboratory tests, log data, evaluate new methods, and study the effectiveness of lab test. So main role is to have a proper idea about examine the samples, yeah, or specimens in laboratory by ensuring the quality is important. So whether the specimen is fit for testing or not, so those things we need to assess, we need to check in a laboratory, and finally we get tested and we'll get the results, and those results will be forwarded to the concerned HOD, yeah, concerned consultant like pathologist, yeah, microbiologist, yeah, biochemist. They will interpret and they will give the some suggestions in a report, yeah, recommendations and report, and explain the significance of laboratory test. So log data, evaluate new methods. So coming to medical laboratory technologist, he can evaluate new methods, and he can start, okay, study the effectiveness of lab investigations too. So again, they also perform calibration, so maintenance, validation, and troubleshooting of instrumentation, and perform statistical analysis to verify the accuracy and repeatability of testing. So in laboratory, a medical laboratory technologist can calibrate the instruments, even he maintain the instruments, and he can validate the instruments. And whenever there is a problem arises in instrument, he can have a troubleshooting of particular instrumentation and perform statistical analysis to verify the accuracy and repeatability of testing. So all these terminologies shall be aware by a medical laboratory technologist. So they consult with healthcare providers on test selection and specimen collection, and are responsible for prompt verbal delivery of critical lab results. So whenever there is a critical lab alert result, so then immediately they should inform to the treating physician, a treating doctor. That is the main job of a technical staff. So according to Center for Disease Control, 14 billion investigations, lab investigations, are conducted annually. And it is estimated that 70% of medical decisions are based on laboratory test results. So it is a huge thing, no? So coming to lab admin, a lab manager, a lab scientist, and who will be having the MSc in laboratory or a PhD in lab. He can be a lab admin, a lab manager, a lab scientist. And what is his role? Mainly a lab manager who oversees the daily operations of a laboratory, ensuring the efficient and safe execution of experiments. Experiments are nothing but investigations. We call them as investigations. We call them as examinations and tests and research them. So they manage staff. Mainly they look HR, that is human resource, and equipment and resources while adhering to safety protocols and regulatory guidelines. What are regulatory guidelines? So a lab admin should be aware of regulatory guidelines. And key responsibilities include ensuring the compliance, maintaining equipment, overseeing personnel, and managing the lab's budget and resources. These are all responsibilities of a lab admin or lab manager. So coming to three more designations can be seen in medical laboratory. One is pathologist, one is microbiologist, and one more is biochemist. So here, why? What is the role of pathologist? The doctor who has MBBS with MD in pathology will be called as pathologist. Normally, they will be HOD of a laboratory medicine department, and they deal with the pathology specimens like tissues and cells, etc. And they report on a report format which is used by the pathology section. So coming to the microbiologist, what is his role? And again, coming to his designation, yeah, his qualification again, he will be having a MBBS and MD in microbiology, will be called as microbiologist, and they deal with microbiology specimens for culture and sensitivity, testing of blood, pus, stool, body fluids, and urine, etc. So then he will test and he will report the particular organism. Yeah, he can say that this is sensitive to a particular antibiotic. All those activities are done under the supervision of a microbiologist. So coming to the biochemist, what is his role? His role is to see that mainly he is having MBBS and MD in biochemistry, and he will be called as a biochemist, a clinical biochemist. They deal with specimens like serum, plasma, and body fluids, etc. So these are the activities which are conducted. And coming to first step, laboratory operating skills, and coming to second step, time management and multitasking, and third step, the skill of being patient, and fourth step is control and prevent contamination in the laboratory, and coming to fifth step, basic knowledge regarding these things, and communication skills, and maintain laboratory etiquettes. All this to be maintained by the laboratory personnel. So coming to next thing is general knowledge about laboratory basic information and skills. So here, what are those basic information we need to have? One is laboratory safety, laboratory laws and regulations, laboratory quality, laboratory mathematics, and laboratory KPIs. So here, under laboratory safety is a crucial thing. Okay, to prevent accidents, we should avoid accidents in a laboratory and ensure a healthy work environment. Here are some key aspects. So one is we need to have a PPEs, personal protective equipments, we call them. And under PPEs, we can have lab coats and gloves that may be latex, nitrile, or other chemical resistant materials can be provided. So goggles or safety glasses we should have, and face shields when working with hazardous chemicals, and closed toe shoes. So all these are material which comes under PPE, personal protective equipment. So coming to laboratory safety regulations. So occupational safety and health administration, OSHA guidelines we need to refer. Under OSHA regulations govern workplace safety, including laboratory settings. And coming to hazard communication, we need to, how are you going to communicate? Laboratories must have a hazard communication plan in place, including labeling, safety data sheets, and training and all those. We need to check. So coming to next is here we can see a diagram, sorry, pictures, do's and don'ts. Okay. The safe way is the right way to perform your experiment for which plan your work before entering the lab. So the students must know the following general laboratory guidelines and what can be done, what not be done in a laboratory. So here, first you have to clean your working area, and you should be in apron, yeah, some whatever the PPEs we should have, and you need to maintain a proper biomedical waste management, and you need to aware of material data, material safety data sheets. All those things can be uh, enter once you before entering into the laboratory. You need to have a complete knowledge of these things. Otherwise, you may have some accidents in laboratory. To avoid such accidents, we need to have a we call it as a code of conduct. Okay, so we have to go through the code of conduct in laboratory. So here, laboratory safety, it is our joint responsibility to keep the lab clean and safe. How? By authorized personnel in the laboratory. Only authorized personnel are allowed in laboratory, and they should have lab coats, and they should worn it, and sensible footwear must be worn. No open shoes, and they should have some caution boards. When there is a wet floor, they should have a caution board. All accidents and dangerous events must be reported and recorded. No smoking of any kind, and do not store any consume food or drink in the laboratory. So all work must be carried out in accordance with the risk assessment, and dispose of waste properly, and as per policy, and have a keep the lab tidy and emergency routes accessible. So here, laboratory waste management. So here, under laboratory waste management, we need to refer the guidelines which are provided by the Pollution Control Board. Hazardous waste, how are you going to manage hazardous waste in a laboratory? Laboratories must follow regulations for handling, storing, and disposing of hazardous waste. So coming to biohazardous waste, laboratories must follow regulations for handling and disposing of biohazardous waste, including infectious material. So here, biomedical waste management thing is there. So where we should put our sharps, whatever it may be, like needles, ampoules, broken glass, blades, razors, or kept in put in red color bin. And coming to biohazard, red container or red liner in container, infectious waste, and blood products, contaminated personal things, protective equipments, and IV tubings, cultures, stacks, and all can be put in red container or red liner in container. So we need to check before putting this waste. And coming to the yellow container, empty vials, ampoules, empty syringes, needles. So in coming to phlebotomy area, where we are going to use the syringes and needles. So before throwing them, we need to check whether it is in going into the yellow container or red container, and we need to follow the guidelines of this one pollution control board, yeah, biomedical waste management tools. So pharmaceutical, yeah, radioactive, whatever it may be, as per criteria, as per guidelines, we need to put in a container. So again, coming to laboratory laws and regulations. So laboratory laws and regulations varies by country to country and jurisdiction. But here are some key aspects. One, we need to check the regulations from CEA, Clinical Establishment Act regulations we need to refer. And coming to NMC, National Medical Commission, and NCAHP, National Commission for Allied Health Professionals, and KPME, it is related to the Karnataka Private Medical Establishment Act, and pollution control certificate clearances, and we need to have a biomedical waste management MOU, and we need to have a fire NOC. So these are the regulations, and we need to get it done before establishing, before starting full-fledged laboratory. So coming to clinical laboratory improvement amendments, CLIA. So CLIA regulations govern laboratory testing and certification in United States. Okay, mainly it plays a major role in USA. So coming to laboratory quality. So what is quality? So laboratory quality prefers or refers to the accuracy. So before issuing a report, we need to check that this report is accurate, and we need to satisfy ourselves. Otherwise, no, if you issue a report, if you don't have a confidence, yeah, if you don't have a satisfaction in your heart, so then definitely it will affect you in a different way. So that's why before releasing the results, we need to assure that the results are accurate. So how are you going to give assurance? So by checking the accuracy, reliability, and consistency of laboratory test results. Key aspects of laboratory quality include: one is accuracy, the closeness of test results to the true value; precision, the ability to detect small changes or differences; and coming to sensitivity, the ability to distinguish between different substances and conditions. So here one diagram is there. We can go through this. You can see here high accuracy is there, and exactly target the results are within the true value. So near to true value, and coming to high precision, and they are highly precise also. Repeatability, it shows that high precision. And coming to this second diagram, here there is no accuracy. We call it as a low accuracy. And coming to the precision, again it is high precision, because all values are at same similar point. Okay. So coming to next third diagram, we can see here high accuracy and low precision. So accuracy is there, but precision, each and every time there is a difference in value result. So that's why it is deferred. We call it as in low precision. So coming to fourth diagram, here we can see low accuracy, low precision. Okay. So by seeing this diagram itself, we can understand what is the importance of accuracy and precision. So here is small diagram. You can see here, to run a quality laboratory, organization and supervision, personnel, equipment, purchasing and inventory, documents and records, process control, information management, occurrence management, and assessment, customer satisfaction, process improvement, facilities and safety. These things we should keep in mind before establishing a laboratory. So quality control measures. What are those quality control measures? One is calibration, ensuring equipment is accurately calibrated. So why calibration plays an important role in laboratory? So before testing, just we need to test quality control material. So in quality control material, so if you go to biochemistry, you find out two levels of quality control. So one is first level, that may be normal path, where normal values will be there. And coming to level two, it may be path controls. So abnormal controls, we call as a abnormal control. So abnormal results will be seen in that quality QC. So then ensuring equipment is accurately calibrated. Once the results, if you see the quality results, no, if you are satisfied, if you see that the results which are generated after having a quality control, if you get plus or minus within the results are within plus or minus 2 SD or 1 SD, so then you can issue report easily. You can process the samples and issue the report easily. So if it is not there, if it is out of plus or minus 2 SD, we need to go for corrective action. That is nothing but calibration. And after calibration, we need to check the QC. If the QC is okay, then we can process the samples. So proficiency testing. participating in external quality assessments programs. So here, under external quality assessment programs, there are a lot of proficiency testing units in India. One is EQUAS, External Quality Assurance, provided by CMC Vellore, and one more proficiency testing, that is AIMS, All India Institute of Medical Sciences, where they process, they send hematology and histopathology specimens to different laboratories for EQUAS, External Quality Assurance Program. And coming to one more laboratory, that is RML is there, and one more laboratory in Karnataka, Bengaluru itself, Anand Diagnostics, they have a proficiency testing centers which are recognized by NABL itself. Okay. So coming to quality control samples, running control samples to verify test performance, standard operating procedures. We need to have some standard operating procedures in laboratory. Whatever investigations we have, for those investigations, we need to have a SOPs, following established protocols for testing and procedures. So benefits of a laboratory quality. So here, why quality is important? So one is accurate diagnosis. A patient comes with hope that the laboratory personnel gives accurate report of what disease I am having, and once I get the accurate report, easily a doctor diagnosis is disease. So that's why laboratory quality is the important thing. Accurate diagnosis, and one is patient safety, and third one is research validity, and fourth one is regulatory compliance. So these four things we should keep in mind. So laboratory accreditation and certification. So there are so many accreditation bodies in India. One is one of the accreditation body in India, that is NABL, National Accreditation Board for Laboratories, for calibration and testing. So coming to QAI, one more, this accreditation body, it is a private body, Quality Accreditation Institute. We call it as a Quality Accreditation Institute. And one more accreditation body, that is the CAP, College of American Pathologists. CAP accreditation is recognized standard for laboratory quality and competence. Again, same thing, NABL also and QA also. And here we see the standard of International Organization for Standardization, ISO. So for laboratories, we use ISO 15189 as an international standard for laboratory quality and competence. So now under ISO 15189, they have updated version. One is that is 15189 2022. Before it was 2012, now it is 2022. So these are the logos which are once you get accreditation from these bodies, you can use these logos. This is NABL logo, and under NABL also now they have started one more. We call it as a MELT, Medical Laboratories Entry Level Program. MELT also is there. Those laboratories willing for accreditation, certification, though apply, they can apply for MELT program. So again, it is a CAP accreditation. So it is a College of American Pathologists. Again, it is also some valid, we can call is a competent body which provides accreditation to those laboratories which are complied with the ISO 15189 standards. So again, one more certification program is available under NABH. Those laboratories willing for quality and safety related aspects, they can apply for NABH certificate also. So they can get NABH certification by ensuring that those standards are implemented in laboratory, which are provided by NABH standards. So coming to QA, already we had discussed Quality and Accreditation Institute. This institute, this accreditation body, accreditation body provides accreditation for laboratories as well as hospitals and other health organizations, health sectors also. So coming to laboratory ethics and conduct, good laboratory practice. We need to refer GLP, good laboratory regulations govern laboratory testing, including study design, conduct, and reporting. So informed consent, where we need to take informed consent. Once if you are going for a retroviral testing, it is mandatory to have a informed consent. Laboratories must obtain informed consent from patients or participants before collecting or testing samples. So again, one more important thing is confidentiality. We need to maintain data which is procured by laboratory after investigations. We need to store them and we need to handle with confidentiality. It is a sensitive information. So other regulations are there. HIPAA. HIPAA is there. Laboratories must comply with HIPAA regulations to protect patient health information. And laboratory developed test. Laboratories must comply with regulations governing laboratory developed test, including validation and quality control. So laboratory mathematics. So why mathematics is important in laboratory? So there are lot of investigations. We need to do calculations. So we need to know the mathematical calculations and units, which units we are going to use. For example, SI units. SI units we can apply. Time is there, mass is there. All those units we need to have some basic knowledge on that, and we can apply those units, yeah, those mathematics in laboratory field. So in laboratory settings, to prepare solutions, calculate concentrations, and interpret results. So concepts in laboratory mathematics. Concentration calculations, calculating the amount of substance in a solution, such as molarity, molality, or percentage. So dilution calculations, calculating the amount of solvent or diluent needed to achieve a desired concentration. Unit conversions, converting between different units of measurement such as milligrams to grams or milliliters to liters. So, what is the importance of laboratory mathematics? Accurate results. Ensures accurate laboratory results and calculations, and safe preparation. Ensures safe preparation of solutions and reagents. Reliable data. Provides reliable data for research, diagnosis, and treatment. So here few things are there. One is laboratory KPI. KPI means key performance indicators. So what is the important role of KPIs? So KPIs play important role to whether the laboratory having the quality indicators. By collecting this particular data, we can improvise ours. Okay, improvise our laboratory. So what are those KPIs? One is percent blood culture contamination rate, and critical results communicated on time, laboratory turnaround time, misidentified request, percentage of repeated investigations, samples with inadequate volume. So all these are KPIs which are mandatorily, which are required to improve our laboratory quality. Thank you.